The Lockman test, also known as the Ritchie test, the Lockman-Trillet test, or just the Trillet test. It assesses the integrity of the ACL. A positive would be abnormal tibial translation on the femur, pain when compared to the other side, or a soft or absent end feel. The patient would be supine, and the clinician would act or passively flex into 20 to 30 degrees of flexion and slightly externally rotate the tibia to provide a straight line of pull for the ACL. I would stabilize the anterolateral distal thigh, and my stress point would be the the medial aspect of the proximal thigh or proximal lower leg. And I would apply a posterior to anterior force sort of in the same angle as the tibial plateau. A compensation would be that the patient is not relaxed and they're trying to actively hold up their leg or flex their knee in some way. For the Lockman test, the patient is laying supine, and on the affected leg, I'm going to hold the proximal lower leg distal thigh about 30 degrees of flexion and externally rotate. Externally rotate the tibia, relax. And in a quick motion, I'm going to pull up and towards myself, sort of at the angle of the tibial plateau. And you should feel the ACL hold. The anterior drawer test does not have any other names. It is used to assess the ACL. The positive finding would be motion greater on the affected side, tibial translation on the femur greater on the affected side than the unaffected side, pain, and a soft and or absent end feel. The patient position would be supine with the hip and knee flexed, knee at around 90 degrees. There's not necessarily a stabilization point because both hands are needed at the stress point, which is at the proximal tibia, thumbs on the anterior aspect of the tibia with the fingers wrapping around. The movement is pulling an anterior or a posterior to anterior force on the tibia, translating the tibia anteriorly, and a compensation would be that the hamstrings are tight and guarding the movement, preventing the anterior translation. For the anterior drawer, the patient's laying supine, knee and hip flexed, and I'm going to sit on her foot so I have stabilization. I'm going to have my thumbs right below the tibial plateau, and in a straight motion, I'm going to pull on the knee, and the ACL should catch. The quadriceps active test does not have another name. It's used to assess the PCL. The positive finding would be anterior reduction of the tibia on the femur during contraction. The patient is long sitting, supine with their hip and knee flexed to 90. There are really two stabilization points, one at the distal thigh and the distal lower leg. There's not necessarily a stress point because it's somewhat of an active test. I'm gonna tell the patient to try and slide their foot forward on the table or attempt to kick out and extend their leg while I'm not allowing them to, creating a quadriceps contraction. And a compensation would be a weak contraction due to hesitation or fear of pain. For the quadriceps active test, hip and knee flexed. I'm going to stabilize the foot, and the patient's going to contract their quad, trying to kick out towards me. And if the PCL was ruptured, you would see the tibia realign with the knee. So go ahead.